It's a good day. I'm sort of excited because a very dear friend of mine, Janice Dickinson, is coming in. We're going to do a few procedures on her face. The big thing that I'm into is structuring faces because people just add volume to the face. So they put a cheek under the eye and they just put a globs here, globs there, and people look peculiar and they have lips like the First Wives Club. That was a joke. But Janice is a person who really tells the story of what I'm about. And what I'm about is understanding the architecture of the face. The architecture of the face is just like a building. You use support structures, the lower third of the face being the teeth. You have cheeks, but cheeks is a zygomatic arch that you see in Grace Kelly and Audrey Hepburn on the side of the face. So if you understand the structure, you can do things with fillers that no one else in the world can do. So today what we're going to do with Janice is go with the flow. And she's a lot of fun to inject. She's a great person, and I think she looks terrific. I mean, she looks amazingly good. And I think what you can learn from this, or I hope you learn, is that if you really get someone who really understands how to use fillers, it's a revolutionary thing. So this is really the evolution of a revolution. I started to use the fillers in America in '79. That's what I try to do, is be better every day. What I hope to introduce you today is the very best of what I can do. And it'll be better tomorrow. So I hope you enjoy the time you're going to spend with me today, because Janice is great fun. I'll just show you a few of the new things that I've learned that really rejuvenate the way you look.
What I don't like about my face is because of stress and smiling all the time in front of the camera, the crow's feet, right the frowning.
Right.
And in here is a touch up, and then of course I smoke. Sorry, right. I got a few lines on top and on top. But
okay.
other than that, it's flawless.
Yeah. Let me just see now. Smile. So Ellen, take a look at these crow's feet for a second. We can get these crow's feet two ways. We can accentuate your cheeks a little bit and get those lower crow's feet. See the lower crow's feet you want to do that? We just add a little bit in our cheekbones below.
Yes.
That was looking pretty good, to tell you the truth. We could do a little Botox in your neck.
Please.
Or we can pull back your neck a little bit.
Do it both.
Finally, what I'm going to do is inject under her back of her neck and pull the skin back here by flowing material in a backward motion and holding the skin very tightly as I flow, and it's going to pull back the neck tissue under her jawline. Basically, we just pull it very gently because you don't want to hurt the patient. The key thing is to make the material flow. You know, you want to just stick it in and put a glob in.
Didn't you invent it?
Yeah, I invented this. I invented all the techniques of injecting, but this is a better technique. It's called go with the flow. But I haven't really taught anyone this technique because I think it's
What's it called again?
Go with the flow.
That's hilarious.
Because it moves the skin with the flow of the material. Let me just take a look at this side of your face. And take a look.
Go with the flow. Yeah, it's amazing.
So I mean, that's what it is. And there's no marks, okay?
No, it was painless.
Yeah.
I didn't feel a damn thing.
What this is going to do is get rid of that dent, but it's counter to what everyone else thinks. So they're pushing in the opposite direction. Now look at your nose. Look at the dent by your nose.
So do one more lower.
Yes, that's exactly what I meant.
Look at her jawline. It's straight now. You see our cheekbone is all out here, and she doesn't look like anything is full in front. Everyone works in front. So on place you work on the sides, you pull back the skin. And this is a technique that's just new. No one else does it. And then what we did is with Janice, is we flow a little material under her lip. We did this to make sure her jaw was the correct height. And then what we did is we gave a little bit in the edge of her lip. Not to enlarge her lip. We want to get rid of the lines, because what you want to do is not make her look distorted. But most of the people I'm doing are actresses cannot believe what I'm capable of doing. I mean, some of the actors come in and say, man, I just want to put off facelift for a year or so. And when they get done, they don't want the facelift anymore. And having 50% of your patients being, actresses are really important people in the world, politicians, socialites, people of that ilk. No one wants to look like they're done. They don't want to look like they're reminiscent of what they used to look like. You vaguely remember them. They have a personality, they have a face. They don't want to look like they've been pulled back like they're walking in a wind tunnel. I take an hour and a half on a face. What I can do, and I show you this, she can go out tonight and look perfectly normal. She can put a drop of makeup on, she's not one bruise on her face, and she looks great. And she looks better than she walked in. So I'm telling you, if there's someone else out there who's doing what I'm doing, that's great, because I love to be more people than me. But I really love what I do, and I have a great time doing it, and I want to be better tomorrow than today. Here you saw me do it. It took an hour, sure enough, that's a long time, but she didn't have pain. You saw a structure return to her face, and she looked like she's well rested. And that's the whole